Happy Thursday. Happy Thursday. Come on in. Well, you know we do our Thursday lives with Whitman-Walker. So come on in. We're going to have a special guest today, as well as have some talks today about COVID-19. So come on in. Welcome to Thursday Chats with Whitman-Walker and myself. We're going to start in a couple minutes, just waiting for people to come in and our special guest today. Hello, come on in. Hey, Dr. Henn, how are you?
Hey, Orlando. Good to see you again.
You too. We got the memo. We got our hairs up today.
Mine is just out of laziness,
Uh,
though.
Mine was to get it out of my face. It's getting so nice outside these days.
It is. It's a beautiful day outside.
Yes. Well, we're going to wait a couple seconds for people to join us. Come on in, everyone. We're doing our Thursday Chats with Whitman-Walker. For those of you that don't know, I am Orlando, a social influencer here with Whitman-Walker. My pronouns are he, him, and his. We will explain today a couple things regarding ACTIV-2 study for COVID-19. Whitman-Walker's Health is best known for outstanding care it provides to its clients and patients in the DMV. But Whitman-Walker also has a huge research team that works on a ton of different studies with many focuses from HIV to hepatitis. Now the team is starting to take on COVID-19 research. So here to talk with me about one of the new studies called ACTIV-2 is Dr. Henn. Dr. Henn has joined me on lives many times before. She is the Chief Health Officer at Whitman-Walker, and we're so excited to have her live today. Do you want to introduce yourself a little more?
Yeah, I'm very happy to be here. So I'm Dr. Henn. I've been with Whitman-Walker for 14 years. I'm an infectious disease physician by training, and my pronouns are she, her, hers. So it's great to be here.
Welcome. We enjoy. This is becoming a regular thing, and I'm
I
okay with
know,
that.
I know.
All right. So we're going to have a couple questions here. So if you have any of your questions or anything you want us to bring up, please comment in the comments below. And if we can answer it, great. If not, we'll get to you in private. Don't be shy. So let us know our first question. How long has Whitman-Walker been doing research, and what studies have you done?
Yeah, so Whitman-Walker has a really long storied history in research. So, as you probably know, and hopefully a lot of the people watching today know, Whitman-Walker really started out as in response to the pandemic in the 80s, and really looked to try to help people. And one of the ways early on, when there were no treatments that we helped, was to get involved in clinical trials to help discover new treatments. And so we actually have been involved in clinical trials that have led to every HIV drug on the market today. We have participated in trials to show those drugs' efficacies, and bring more treatment options to our patients. So yeah, since the 80s.
Oh, wow. That's around the time I was born. So if you know how to do the math, almost 40 years, people. So let's see. Can you tell me a little more about the ACTIV-2 study? What is the purpose of the study, and what is your desired outcome?
Yeah, so the ACTIV-2 study is a really great, exciting trial. I think, with ACTIV-2, ACTIV-2 is the site. There are multiple sites around the country, and they're now starting to be international sites as well. And these sites all actually, most of them are AIDS clinical trials group sites. And so, just as we've responded to the HIV epidemic with COVID in the past year, we've had to respond to that. And early on, as everyone I'm sure is aware, there were no treatments. I mean, people were told to stay home unless you got really ill. And we've made incredible progress in the last year, and there are now some effective treatments. And this study is looking to find more effective treatments that can be given to people when they're home, when they're outpatients, when they don't need to go to the hospital, to prevent them from ever having to be hospitalized from COVID. So looking at both IV infusions that people can get, but also some inhaled agents, injections like sub-Q injections, and hopefully we'll also have oral agents soon.
Okay. So who is eligible for that ACTIV-2 study?
So anyone with COVID, really. So if you've been recently diagnosed with COVID, please give us a call, and it will depend when you were diagnosed. We want to obviously get people on treatment in the trial as soon as possible to help figure out if these agents are, really effective, and so that they help people as much as possible. So um, that's pretty much it. I think there's some other criteria, but we'll talk people through it if they reach out to us. So.
Okay. And how can someone who's interested get involved in the study?
So you can go to our website, you can find a link there. And you know what? I must admit, I've totally failed. I did not write down our phone number and I can't remember it off the top of your head. Do you
Don't
have it
worry,
in
they'll
front
put
of
it in
you?
there for us.
They'll put it in there for us. Someone is more
Yes,
organized than me.
someone is
Um,
definitely there. Don't worry. Let's
so.
see.
Yeah, but absolutely, we have all our trials on their website. So if you go to Whitman-Walker research, if you Google that, you will come up with it. ACTIV-2, you can also Google that on the web, and there's a nationwide phone number. So even if you aren't in DC, but if you're somewhere else in the country and diagnosed with COVID and interested in possibly enrolling in the trial, you can find out the phone number, nationwide phone number that will link you to a trial site as well.
Perfect, perfect. So, did I ask already how someone can get involved? Is that what we just answered now?
That's what we just answered.
Okay,
Yeah.
perfect. Just making sure. A lot of the questions look the same, so I'm like, let me make sure. So, if how can someone who's interested engage in other study opportunities with the Women Walker Institute's research team?
Yeah, so we do a variety of trials. We've done COVID prevention and treatment trials this year, but we also are continuing to do HIV prevention trials, PrEP trials, HIV treatment trials, hepatitis C treatment trials as well. So if you have any one of those conditions or want to prevent yourself from getting any one of those conditions, go onto our website and you can fill out some basic information and we'll reach out to you to discuss opportunities.
Okay. And let's see if anyone has any questions. Everyone's been super quiet today. It's okay, it's Thursday. Nothing, nothing. Someone sent you some blessings, Dr. Sarah.
Thank you.
Perfect. We appreciate you. So nothing there. So anything else you want to let us know that we can?
No, I think it's just, I want people to know that we're here doing this work, that, there are now effective treatments for COVID, and we're working to find more treatments for COVID. So, this epidemic isn't over. Stay safe. But if for some reason you do unfortunately become infected, reach out to us, whether it's to participate in a trial or to access other treatment through emergency use authorization. We want to be here to help.
Perfect, perfect. Well, we appreciate all that information. And to our viewers, don't forget that we are still open for HIV and STI testing by appointments only at our Liz location Northwest DC and our MRC location in Southeast DC. To make an appointment, you can call our 202-797-4439. And as always, don't forget we are still in a pandemic, so social distancing is our way to reduce the amount of COVID-19 community transmissions. It deliberately increases the physical space between us to avoid spreading the illness, especially around holidays and now nice weather. Everyone's going to be outside now thinking it's okay, but still be careful around a lot of people. Stay 6 feet away. If possible, wear your mask over your mouth and nose. Avoid places with large crowds. Try to work from home if it's possible. If you don't feel well, stay home. Speak with your loved ones over phones, FaceTime instead of in person. And social distancing is as caring for our community And don't forget to stay up to date with your local, state, and national guidelines for testing, quarantine, and now vaccinations. So
Mm.
pretty much they're going to be opening soon. So make sure if you haven't registered, register. If you can help someone who doesn't know how to, help them register. Talk to your family, talk to your non-English speakers, and make sure they know how to, or know that it's super easy, it's free. So make sure they know that so they don't get scared about doing it. Get vaccinated when you are eligible, and don't forget to follow us on Facebook, Twitter, and Instagram. Thank you so much, Dr. Henn, for joining us today.
Thank you and have a great evening.
Thank you. We'll see you soon, hopefully.
Yep.
All
Take
right.
care.
Take care. Have a good afternoon, everyone.
All right. Bye bye.